9, okay. Yes.
We received for the year 2020 18,026,691 as total receipt. This comprised of government subvention, contribution from the Gambia Social Safety Net Project, and loan recovery. The total expenditure for the same year was 18,322,488. In that year, there is a deficit of $295,797. That is for 2020.
Okay.
We go to 2021. The year 2021, page 9, the same for the second booklet.
Also page 9?
Page 9, yes.
Okay.
The agency received 24,658,381. This comprised of the government subvention, contribution from the Gambia Social Safety Net, and other sundry receipts. In terms of expenditure, the agency expended $24,626,495. This left the agency with a surplus of $31,885 for the year 2021. This is the financial statement for the 2 years, 2020 and 2021. Thank you.
Thank you. National audit. It's not working? Thank you.
Honorable Chair, please refer to page 7 of 2020.
Page?
Page 7 of 2020.
Page 7. Yes.
We have audited the accompanying financial statement of the National Nutrition Agency, which comprised of the statement of receipts and payments and related notes for the year ended 31st December 2020, are set out on page 9 to 15. In our opinion, the financial statements and related notes set out on pages 9 to 15 present fair in all material respects of the statement of receipts and payments of the National Nutrition Agency for the year then ended 31st December 2020, in accordance with International Public Sector Accounting Standard IPSAS cash basis. Now we can go to the ML of the same report. Please refer to page 24. The National Nutrition Council.
24 years.
I'll skip the composition. I'll go straight to the chairperson shall preside at every meeting of the council at which he or he is present, and in her or his absence, the members represent shall appoint one of their number to preside at that meeting. The minutes of every meeting of the council shall be recorded and signed by the secretary and the person who presides over that meeting after confirmation by the council. The council may at any time co-opt any person to act as an advisor at any of these meetings, but no person so co-opted shall be entitled to vote at any of its meetings. Finding on page 25, discussion with the Deputy Director of NaNA revealed that although there exists a council, it is not functional as expected. Recommendation: management should ensure that they make follow-up with those concerned on the functionality of the council. Board signature. Finding: we noted that a member of the board was paid a sitting allowance during the period under review. However, he did not sign on the sundry voucher attached as evidence of receipt. Recommendation: management should ensure that all board members receive an allowance for sitting signed for it as an acknowledgement of receipt of money. Auditors for the comment: the strategy recovery plan mentioned above was not submitted to our office for review. The PIC and PSC meeting. Finding from review of the Project Implementation Committee and Project Steering Committee meeting minutes, we noted that the committees held meeting only once for the period under review. Recommendation, management should ensure that board meets at least once every quarter as required in order to discharge their function as an oversight committee and add value to the agency. Auditors, for the comment, the matter is not about meeting requests, but ensuring that meetings were held as required. On page 30, difference between financial statement and the activity report. Page 30. The audit noted from the inspection of the agency 2020 activity report and its 2020 financial statement a significant variance on the reported income and expenditure in the activity report. Details are shown below. Recommendation, management should ensure that they report their financial information accurately in their annual activity report as stated in their financial statement to avoid misinterpretation of their financial activities by users. Auditors, for the comment, there was no revised activity report attached to confirm this against the financial statement. Thus, this finance is still outstanding at the finalization of this audit. Page 32, improper maintenance of staff personnel files. Finding, the audit noted from the samples selected for inspection of staff personnel files that there was no folio number reference to correspondence received or sent in the personnel file for sequence of events and easy reference. Recommendation, management should ensure that all staff personnel files are correctly referenced and arranged chronologically or without delay. No IT service continuity. We noted that the agency did not have a backup stored in a secure offsite storage facility concerning the NaNA operation account, data protection and recovery. Recommendation, management should ensure that an IT service continuity plan is put in place for data kept offsite from the office, updated and tested regularly. On page 34, call booking sheet. We noted that the booking sheet for the whole rentals was not furnished with all relevant details, including PV numbers, receipt numbers, pay-in slip numbers, which are essential for referencing and reconciliation purposes. Recommendation, management should ensure that the controls around the collection of the agent for rental revenue are strengthened to mitigate any revenue leakage. Rental income on page 36.
36.
36, yes. The audit noted that the agency restaurant was rented out to a catering service provider, X, for 72,000 per annum. The restaurant had an outstanding rent of 85,250 as of 31st December 2020. Details are shown below. Recommendation, management should ensure that the outstanding rent is recovered from the restaurant service provider and action taken to avoid recurrence of such. Page 38, management fee. We noted that from July to December 2020, management fees from the Social Safety Net project amounting to 5,495,140 were paid to all staff on different rates. Although board approval was provided, we could not assess of the rates applied in the absence of a detailed calculation showing the rates applicable for each staff. Details are summarized below. Recommendation, management should ensure that they furnish our office the basis for these calculations for verification. Auditors, for the comment, the finding has not been addressed after the finalization of this report. Page 42 of the follow-up. The fuel register was implemented, risk management policy implemented, organizational chart implemented, rental income not implemented, project implementation committee and project sharing committee implemented, overstatement of income implemented, reform of pre-finance implemented, accounting manual implemented, no strategy plan not implemented, no security management, IT security policy implemented. That's for 2020. Please refer to page 7 of 2021. We have audited the accompanying financial statement of the National Nutrition Agency for the year ended 31st December 2021. The financial statement comprised of statement of receipts and payment and a summary of significant accounting progress and other explanatory information set out on pages 8 to 16. In our opinion, the financial statement and related notes present fairly in all material respects of the statement of financial performance for the year ended 31st December 2021, in accordance with international public sector accounting standards, cash payments. Ipsos cash payments. Honorable Chair, for 2021, I will go straight to the prior year audit matter. On page 27, risk management implemented, rental income implemented, accounting manual implemented, no strategy plan is at the draft stage at the time, no security management implemented, National Nutrition Council not implemented, board allowance signature not implemented, PIC and PSC meeting not implemented, presentation format implemented, incorrect treatment of refund implemented, disclosure of receivables implemented, difference between the financial statement activity report implemented, difference between the ledger and financial statement implemented, improper maintenance of staff personnel file not implemented, no IT service continuity not implemented, bulk booking seat implemented, variance on budgeted figures not implemented, misstatement of income implemented, management fees not implemented, late payment of withholding tax implemented, misclassification of expenditure lines implemented. Thank you.
Thank you very much. That ends the presentation on both the financial statements and then the management data for 2020 and 2021. While we await the clerk to print us the report from GPBA, can we take the activity reports? We have two booklets also for activity reports, 2020 and 2021. Chairperson, who will lead us in the presentation of the activity reports?
The acting executive director will do that. Thank you.
Yeah, you can do the summary of the presentation of the activity reports.
Thank you, Honorable Chair, and let me also seize the opportunity to thank the other members of the committee and the subject matter specialists, the Accountant General's Office and the GPPA and my team for this opportunity. We, as an institution, we are established in 2000 and formally enacted by the Act of Parliament in 2005 as a legal entity to define roles and responsibilities. We are charged with responsibility of coordinating all nutrition and sanitary activity in the country, facilitating intersectoral collaboration in the area of nutrition, implementing the national nutrition policy, and also we serve as a secretariat to the council, the National Nutrition Council, the scaling up of nutrition secretariat in the Gambia, and the National Alliance for Food Fortification. Our mission is that we want to improve the nutrition status of the by reducing malnutrition, morbidity, and mortality among the general population, especially the most vulnerable group, which is usually the pregnant women, lactating mothers, and children under 5, thereby contributing to the productivity of the Gambian population.
Are you reading from the text?
I'm reading from the mission.
Yeah, you should read from something that is available to members. You are presenting the report.
Yeah, this is part of the report. It's
Yeah,
the
what
back-
you are presenting should form part of the text.
It's the background of the report. It's in the report.
Yeah, then guide us, which page are you referring to or reading from?
Okay, let me go to the main report. Just for a minute. Okay, I made a summary of the report. So I have to read from the main report then. Okay.
Yeah, if you have the summary version.
Okay.
can-
I'll just go through the 2020 report directly.
Okay.
This is in page. Let me go to the report directly. So this is in page 1. Huh? I'm going to read in page 1. Page 5. Huh?
Page 5.
Yeah,
Okay.
page 5. Introduction. For the agency to attain the national nutrition policy vision of the Gambia free of malnutrition and to ensure a healthy and sustainable livelihood for all Gambians, NaNA works with all stakeholders, including community and community-based organizations involved in nutrition activities in the country. This involves mainstreaming nutrition into sectoral policies, programs, and strategies to improve the coordination of nutrition interventions in the country, social and behavior change communication, with a comprehensive nutrition program plays a major role in our drive or strategies towards achieving our mission. I will skip the background that talk about the various things. I will go to page 7. Page 7 is the progress report on the policy priority areas. We developed the program, the report based on the policy priority areas. The first priority area is maternal, infant, and child nutrition. Under this program, we have done the capacity building training of health workers on the baby-friendly hospital initiative. This is a program that is launched by UNICEF and WHO and ordered by the country to promote, protect, and support breastfeeding, especially in healthcare facilities. So with this program, we want to ensure maternal units in health facilities become certified as baby friendly. We work with UNICEF to conduct the BFCI training for Bundung Maternal General Hospital and Kanifing General Hospital. The idea of the training was to build the capacity of health workers in these facilities to be able to provide lactation management support to mothers and their children attending these facilities with the ultimate aim of making the hospital very friendly. We've trained about 60 personnel from the two facilities in a 3 days period. Similarly, we also train the staff in SL District Hospital on the same concept, all geared toward ensure that at least we have a facility that is certified as baby friendly. To be certified as baby friendly requires implementation of 10 steps to successful breastfeeding, which the staff we are trained on. On the 2.1.2, Mother Meat Upper Arm Circumference Initiative. The Mother MUAC initiative is a concept aimed at empowering mothers to consistently and regularly assess nutritional status of their own children so that the corrective measures can be done to improve their health and nutritional status. As an agency and as a country, we have instituted programs to assess nutritional status, but these are done periodically. The most regular one of them is the surveillance. But this Mother MUAC is an idea to train mothers themselves to assess their own the state of their children. So when the child is malnourished, it can be detected earlier and corrective measures can be done before they get into severe form. So this initiative is supported by UNICEF in collaboration with the Ministry of Health and Social Welfare. We have trained mothers in North Bank West, North Bank East, Central River Region North, and URR. In each of the region, we trained 10 communities, and each community, 10 members of the 10 mothers were identified, and they were trained They go back into the community. They do their own assessment of their own children and also assess the children that are in their neighborhood. All geared towards assessing to detect malnutrition as early as possible and intervene to improve the situation of students. 2.1.3 is the conditional cash transfer to pregnant women who book in the first trimester. This is part of the maternal and child nutritional health resource project. That effect the last payment. This came towards the last end of the project. We effect the last payment to women who book for early antenatal care in the first trimester in April 2020. Following verification, each of these mothers who book early in their pregnancy are paid $300 as part of the project. This is because in our culture, women don't come out early when they are pregnant. They delay until they are 5 months, 6 months, or even 7 months before they register at the clinic. And in that case, if there's any defects, it will be difficult to detect early and corrective measures are done. So this is to entice women to book as early as possible within the first 3 months of their pregnancy. And anyone who book in the first 3 months of pregnancy is paid $300 as an enticement to encourage them to book early. So this has improved the early detection of women mothers in facilities. And we pay about 3,625 women were registered in the first trimester, and each of them have received $300 each as a token of appreciation of booking early. On the team 2.2, food and security, on conditional cash transfer payment, as part of the implementation of the same project, vulnerable households were selected in some communities based on their level of malnutrition and were provided with inputs such as sheep, goat, backyard garden materials, poultry or small-scale food processing machines, like grinding machines and so forth. They were also provided with 1 year monthly unconditional cash transfer of $1,000 to build their resilience. The monthly cash transfer of $1,500 continued from January to March 2020. During each of the payment, social and behavioral communication was provided to the mothers, or to the recipients, of the cash to encourage them to adopt behaviors. The cash is to allow them to rear the animals, because as a poor vulnerable household, if you give them a sheep or a goat, they don't have food on table, the likelihood of selling the goat is great. But if you give them the cash can solve their immediate problems while they rear the animals. If the animal becomes...
If I may come in.
Yes.
Please, I think just do the presentation, and then I think the explanation will consume time.
Okay.
We have limited time, please.
All right. 2.3 is team 3 of the policy on infectious disease. On this team, 2.23.1, we train healthcare workers on nutrition, HIV/AIDS, and tuberculosis. The National AIDS Control Program and NaNA, with support from the World Food Program, organized training of health workers in all the health regions in July. The objective of the training was to expose healthcare workers, providing services to help people living with HIV and AIDS at the various art centers on the importance of nutrition and its relationship to comprehensive HIV and TB care. We trained about 60 participants from various regions and equipped them with knowledge and skills to link between nutrition and HIV and TB, advocacy for nutrition needs of people living with HIV and AIDS in terms of energy, protein, macronutrient needs, water, and fiber needs. We do the screening and assessment of, especially for those that are at risk of malnutrition, nutritional care and support of infants and children with HIV-positive parents, nutritional education and counseling for integral and parental nutrition support of clients for referral and follow-up, and the importance of the support from the nutritional care in the community. We also do the training of healthcare workers on outpatient management of severe acute malnutrition. A set of 45 health workers were trained on outpatient management of severe acute malnutrition (SAM) in Western Region 2 in Biam, and URR in Pasay, where 15 healthcare workers from each of those regions were trained on the management of SAM at the OPD and community level. Similarly, we also did training of healthcare of nurses on severe acute malnutrition, focusing on the inpatient management. Nurses working at the hospital wards or clinic wards, where children with severe acute malnutrition are admitted. In both Farafenni General Hospital and Bansang, we are trained on severe acute malnutrition SAM treatment and management. The training provided to build the capacity of nurses and help improve management of children with severe acute malnutrition to reduce case fatality. Due to COVID-19, 15 nurses from Farafenni and 15 from Bansang were trained with support from UNICEF. 2.3.4, we distribute sanitary materials. During the later part of 2019, the Project Implementation Committee, the PIC of the MCHRP, embarked on distribution of sanitary material to village support groups. The distribution of the three remaining material was completed in the first half of 2020. The aim of the exercise is to provide communities with facilities to help them clean environment. This will eventually help reduce transmission of diseases, especially to children, hence prevent the occurrence of malnutrition. The last batch of sanitary materials, which includes spades and metal rooms, were distributed to the North Bank region. We distributed our 220 spades to 49 communities and 60 metal brooms to 30 communities. On the update on the construction of incinerators, healthcare waste is the total waste stream from the health facilities. That includes SAPs, non-SAPs, blood, body parts, chemicals, pharmaceuticals, medical devices, and so on. Poor management of these exposed health workers, waste handlers, and community to infections, toxic effects, and can result to disease or injury. As part of the World Bank Environmental and Social Safeguard Policy, incinerators were built for the care facility to take care of the increased waste generated as a result of increased uptake of services induced by the project. In total, 34 incinerators were built, as shown below, where we built 4 in North Bank region, 8 in North Bank East, 6 in LRR, 7 in URR, and 9 in CRR. In a bid to commission the newly built incinerator, we also trained
Sorry for intervening again.
All right.
I did say we try to summarize, but it appears you are reading the whole text.
Okay. Okay.
Just the heading and then
the main one.
Summary of it here.
Okay, I'll do that now. So for 2.4, which is the fourth theme, preventing and management of micronutrient deficiencies, we facilitated the clearing of vitamin A and capsules to the Ministry of Health. NaNA in the Ministry of Health and UNICEF procure vitamin A capsules and ready-to-use therapeutic feeds, which are used for management of CSM. Yes. In the prevention of, in 2.2.5, prevention and management of diabetes and non-communicable diseases, we have done diabetes and hypertension projects. This is to promote and educate people with diabetes and hypertension or non-communicable diseases to live long with the disease. In 2.6, nutrition emergency, the technical support to government food distribution. During the COVID-19, we support the government to come up with the food basket or requirement for the government food support to the population as a result of the COVID-19 lockdown. On the 2.2.6, as part of the BREST project, COVID-19 unconditional cash transfer, we also supported households in providing cash transfer of 1,500 and 1,300 2 rounds to households to mitigate the impact of COVID on the household. On 2.6.3, NAFA cash transfer through the Soil Safety Net project. During the COVID-19, we restructured the project and we divided the cash transfer to 69,793 beneficiary households, where we disbursed about 209 million for the first round and 78,350 in the second round, where we distributed 260 million. Altogether, we distributed 470 million, 154,000 to vulnerable households in 30 districts in the country during the COVID-19 pandemic. 2.7, mission surveillance. This is carried out by community health nurses to assess insurance status of children in community employment healthcare villages. This was also carried out in February, March 2020. 2.8, insurance research. Joint food and insurance security survey with the SEALs and ECOWAS. We also conducted a joint survey to fit into the harmonized framework that is developed every year with our participation and other stakeholders in the country. 2.8.2, the harmonized framework workshop was conducted in the country in partnership with the Ministry of Agriculture and other stakeholders, where we look at the vulnerabilities status in the country, particularly in terms of global acute malnutrition. 2.8.3, the Mother, Infant and Lactation Quality Project. We work with the MRC as a research institution to understudy the milk quality of mothers in the country. 2.8.4, the cost of hunger study. The government of the Gambia in 2018 commissioned the COHA study that was conducted to provide evidence to justify the need for increased investment in nutrition, to provide compelling argument to support the concept of human capital gain that will help consider Africa's economic expansion and estimate the social and economic impact of undernutrition of children at the level of health, education, and labor productivity. The findings of the study were disseminated. The 2.8.5, the Gambia Democratic and Health Survey. NaNA also participated in this survey together with GIVOS and other stakeholders, and the results are available. On the cross-cutting issues, 3.0, 3.1.1, coordination and program management, the meeting of the MCNHRP, we did a stakeholders meeting of this. The project was evaluated, and ICR implementation completion results was produced. The bank used that to gauge the level of satisfaction of the project, and the bank from this report shows that the project was satisfactory, but this was subject to a peer review by the bank executive board that upgraded the final finding ratings to highly satisfactory. 3.1.2, restructuring of the project. Due to COVID-19 pandemic, the social safety net project was restructured to allow for the NaFA quick cash transfer. 3.1.3, consultation with the regional governors on the GSSNP. We conduct the consultation with the governors to inform them about the project. We have weekly meetings with the World Bank and the country team on the social safety net project. On the 3.1.5, we update on the grievance redress mechanism, the GRM. This is done through the toll-free as well as the community GRM structures. On the training of 3.1.6, we did training on procurement to improve our capacity on procurement management. 3.1.7, we did some major procurements during the course of the year. 3.2 on social behavior change communication. We did the training. 3.2.1, we did training for MCHRP, SPCC training of MDFTs. 3.2.3, we review and update the tools and manuals for SBCC and CM. 3.2.4, we develop tools from the NaFA program, especially looking at social behavior change communication. 3.2.5, we produce a newsletter, biannual newsletter for the agency, and produce copies that were shared with stakeholders. On 3.3, formulation of policy and strategies, we drafted the nutrition bill through a consultant. 3.4, monitoring and evaluation. We conduct joint monitoring and of strengthening resilience to food and nutrition security in the Sahel, the PRSP, implementation activities in the regions. 3.4.2, we develop and finalize the MNU strategy for the social behavior and communication for the MCHRP. 3.4.3, the MOH, Ministry of Health, Regional RBF Committee and NaNA have joint monitoring conducted into the project areas. 3.4.4, monitoring assessment exercise on the implementation of BFHI was conducted. 3.4.5, we did iterative beneficiary monitoring to get the satisfaction of the beneficiary on the NAFA quick cash transfer. On 3.4.6, we did monitoring of the nutrition activities across the country, especially in the North Bank West region, and the findings are available. Our key partners, Honorable Chair, are government institutions, especially the Minister of Health, Minister of Agriculture, Basic and Secondary Education, Community Development, Social Welfare, National Aid Secretariat, the UN agencies, the NGOs, the University of Gambia, and SIL. Of course, we learned some lessons that are in the report for your perusal. We have few challenges. One of them is the inadequate capacity of community level operations of the PSC, despite all these, the SOPs and also. We also have few conclusions that are in the report. So I'll move to 2021 report, with your permission, Honorable Sir.
May I proceed?
For 2021, I'll skip the background. It's the same background that is in the 2020. I'll go straight to the activities.
You can skip that one. Proceed.
Activity report 2021.
Page,
Page 6.
page 6.
Page 6. Familiarization visit to baby friendly hospital in facilities. Bundung General Hospital and so forth. We did visit these facilities to gauge the level of implementation of the program. 2.2, community engagement of village support groups and mothers on the use of MOAC was also conducted, where we met about 150 mothers in CRR and North Bank. 2.3, integrated management of acute malnutrition technical working group meeting. The technical working group meets in Buam to review progress in implementation of the program. The mother-led MOAC convergence. The community that are implementing the MOAC were put together to kind of exchange ideas and review the progress that we have done and learn lessons from each other. 2.5, distribution of micronutrient powder and orientation of VSGs was done, where we meet about 278 village support groups. 2.6, we further trained about 75 mothers on the modern work to increase the number of mothers who can do the assessment of students in the communities. 2.7, we do the retraining of village support groups in URR and North Bank East. 2.8, we train village support groups on basic nutrition and screening in URR, Taibatu, and Bakadaji. 2.9, we train on scaling of nutrition business network members were trained to build capacity of the business sector in their contribution to nutrition improvement in the country. 2.1.0, we did orientation of community soil adaptation groups in North Bank and Phoenix. 2.11, we conduct task force meeting for iron disorder to look at the level of IDD in the country. 2.1.2, we did quarterly NTAC meeting where stakeholders meet to review progress and also plan for the coming quarters. 2.13, we conduct celebration of World Breastfeeding Week, which is done annually in August. 2.14, we did training of nurses on severe acute malnutrition inpatient management in Farafenya and Bansang. 2.15, we did prevention and management of malnutrition, where we procured vitamin capsules, mabendazole, and ready-to-use therapeutic foods for management of SAM in the country. 2.16, we did cash transfer for mothers with vulnerable children in the North Bank as part of the COVID support. 2.18, we conducted biannual nutrition surveillance by community health nurses in February, March, and August, September. 2.19, we also conduct sentinel surveillance to fill the data gaps that is known in the country, so we can have consistently data of malnutrition in the country. 2.20, we also participate in the cadre harmonisé, the harmonized framework workshop, where we look at the vulnerability across the country. 2.21, we participate in the MRC, Modern Infant Lactation Quality Project. 2.22, we did a rapid food consumption survey in the country to look at the consumption pattern of 45 foods or food vehicles that can be fortified. We do 2.23, we sensitized National Assembly Select Committee on the NAFA program. 2.24, we sensitized the Regional Technical Advisory Committee tax on the Social Safety Net project. 2.25, we arranged the regional structures and MDFTs on the committee validation. 2.26, we conduct weekly bi-weekly meeting with the World Bank and the Gambian team on the Social Safety Net project. 2.27, we train MDFTs on the GRM. 2.28, we conduct orientation of community GRM structures. 2.29, we review the NAFA program operational manual to update it and make it align with the project operational plans. 2.30, the Nutrition for Growth Summit, we participated in this summit, and Gambia have made some commitments that are seen on the table below. 2.31, the regional workshop for experience sharing on Nutrition for Growth Summit commitment progress in West and Central Africa, we participated in that meeting. 2.32, NAFA program committee session, we sensitized the committee on the NAFA program, where we want to target 15,606 households by giving them by monthly cash transfer of $3,000 per every round. 2.33, we conduct committee evaluation and TOT for sit-down training for stakeholders from the community development, social welfare, and NaNA. 2.34, we train trainers on social behavior and communication. 2.35, we did the sit-down training of stakeholders on social behavior and communication. 2.36, we produce our bi-yearly newsletter and produce copies and share with partners. 2.37, the draft of the bill has progressed over that period. 2.38, the approval of the policy came from the cabinet. The cabinet has approved the 2021 to 2025 policy. 2.39, we did committee validation of the list of households that are supposed to be included in the NAFA program. 2.40, we did community enrollment, where we enrolled the verified or validated households into the NAFA program as a pilot in 3 districts. 2.41, we did assessment of the village development communities in the pilot district to look at the functionality of the VDCs. 2.42, we update the 40-month planning and monitoring tool for food fortification. 2.43, we develop NAFA program management information system, looking at the various modules for the NAFA program. 2.44, we print beneficiary cards for all the households that are enrolled in the NAFA program for the payment. 2.45, we monitor nutrition programs across the country, looking at BFCI, BFHI, IMAM, and so forth. 2.46, we conduct a baseline panel analysis for the NAFA program para districts to look at the status at the time of the beginning of the program. 2.47, we did monitoring visit to pilot sentinel sites, sentinel facilities to look at the preparedness of the facilities and the requirements for them. 3.0, our partners, as usual, government partners, UN agencies, NGOs. The lessons we have learned include the combination of SPCC and CM could improve international status. We have few challenges that we face, especially the emergence of COVID-19 can seriously affect the gain that we've made allocate resources to implement and scale up mission programs, and allocate workforce at national, regional, and community district level. And we have some conclusions that we have. This is the report we have on the side. Thank you for your kind attention.
Thank you very much. Can we proceed with the presentation on GBA compliance?
Thank you very much, Honorable Chair. Honorable Chair, I'm here to present the annual compliance review report for National Nutrition Agency, NaNA, for the year ended 31st December 2017 to 2020. May I refer you to page 7?
Page?
7.
Okay.
Non-compliance. The team of reviewers saw that NaNA have an organizational structure which shows the reporting line of the specialized procurement unit to the finance and admin department. However, according to the regulation, the SPU shall be directly answerable to the accounting officer, CEO. Recommendation: we recommended that procurement unit be under the supervision of the executive director in order to make the unit more independent from the finance and administration. Page 10. Non-compliance. During our review process, GPPA Form 100 national requisition was complete. However, we observed that the estimated cost is always the same with the amount quoted by the supplier recommended for award. This shows that Form 100 is filled after collecting invoice from the suppliers. Recommendation: the SPU shall ensure GPPA Form 100 national requisition is complete at the stage of any procurement process. This will solely help the institution to establish price reasonability offered by potential suppliers when compared with the prevailing market price. Furthermore, the cost estimated on the Form 100 guide the institution in terms of fund availability to start the procurement. The award criteria shall be clear, specific, to help the contract committee select the most responsive supplier as per the requirements laid out in the solicitation document. This will further make our decision more transparent and justifiable. Page 11, non-compliance. The review team was informed that the following named on the table below have been appointed members of the contracts committee, but there was no evidence provided to prove that members were appointed formally, which is a violation of Section 47(3) of the GBP Act and the Regulation 18(2). Recommendation: the PO should ensure that members of the contracts committee are appointed formally in writing as cited in Section 47(3) of the GPP Amendment Act 2018 and Regulation 18(2) of 2019. Page 16. Non-compliance. During the year under review, there was no annual procurement plan for 2017, 18, and 2020, which is not in line with Section 29 of the GPPA Act and the Regulation 25/125(2). Recommendations: National Nutrition Agency should ensure that annual consolidated procurement plan and any adjustment or update in annual procurement plan is sent to GPPA as the authority accordingly. The same page, the same page 16, non-compliance. During review of the procurement proceedings, we observed that some requests for quotation and single source procurement transactions had no technical specification, which is not in line according with the GPPA section 25.1.2.3.4 of the Act 2018. Recommendation: the PO should ensure that specifications are generated in all procurement and provided in the solicitation document each transaction to help promote fair competition, transparency to all prospective suppliers to compete in the procurement process as required in GPPA Act 2018 and Section 25.1, 2, 3, and 4. Page 19, non-compliance. There is no secure facility for the receipt of tender or quotations as per the GPPA Regulation 53.2. Recommendation: for purpose of integrity of the procurement process in line with the objective of the Act, there is need for PO to have both the tender and quotation box in secure within the premises, preferable next to the Executive Director's office. The agency's suppliers shall be sensitized to start delivering quotations and bids to the tender quotation box. Page 21. That is procurement of materials for the security door lock. Category good, amount 4,605.75, awarded to HICTEC Engineering. Single source. Non-compliance. The procurement documentation were incomplete because Form 100 was not attached as stipulated in Section 35.2 of the GPPA. We move to page 23, recommendations. It is recommended that NaNA to establish a disposal committee. NaNA should ensure that GPPA reporting forms are administered at every stage of the procurement process. It is recommended NaNA to ensure that all procurements are conducted by SPU. The SPU should directly answerable to the accounting officer, executive director. Request training for contract committee members to have a better understanding of the right procedures of public procurement. To always seek advice and guidance from the authority on procurement related issues. SPU should ensure that all GPPA forms are administered and attached on each transaction. Conclusion: using the above compliance 24 related variables and specific findings on some of the procurement transactions for the period under review, NaNA was found to be 85%, which donated mainly compliance with the Gambia Public Procurement Authority Amendment Act 2018 and Regulation 2019. Thank you very much, Honorable Chair.
Thank you very much. Honorable member, that has brought us to the end of the presentations for the activity and financial reports 2020-2021 and the GPA compliance from 2017 to 2020. The institution is scheduled to be considered tomorrow at 10 a.m. from 10 to 1:30 in the afternoon. That is all the reports that are duly presented will be considered tomorrow from 10 to 1:30. Honorable member, in the absence of any other business, can somebody move that we adjourn the meeting until tomorrow for NaNA? In the meantime, in the afternoon, we have another institution that will be appearing for presentation. And then who will second? Yes. Then obviously the chair will second. On that note, the meeting stand adjourned until tomorrow, 10 a.m. And we commend NaNA. I will not comment for now, but for your job well done. Thank you.
Thank you.